Okay. So hello everyone, and we have Dr. Sara also now with us. It's a pleasure to be able to interact with all of you all today, and we have a fun and interactive session lined up. So hope all of you all enjoy and also learn a lot about ergonomics in the process. So let's start with a few poll questions. We just want to understand the crowd that we are interacting with today. So Anshik, if you can just put in the first poll question.
Sure. I'll put, so all the questions will be there, they'll be there, all the questions would be there.
Okay, great.
So I've launched the poll already.
Yeah.
People, you can actually start answering the question.
Okay, so you can pin Dr. Sara now, so she can take over.
Sure.
All right. And in the meantime, I want you all to, just fill out these questions so we come to know and we can accordingly, give you all few feedback and, tips to manage things. Over to you, Dr. Sara.
Hi, everyone. Good morning. I hope you guys are doing well. Yeah. So before we start talking about posture and ergonomics, it is very important for me and Dr. Ashwini to understand that if you guys have ever heard that sitting is the new smoking. So I can see slowly and gradually you are voting. Okay. So I can see more people are saying that they already know it. Few people are still left to reply. Yeah, very good, very good. As many of you will be respond to it, you will understand whether it is actually the new smoking or it is not. Go on.
I can actually see a lot of people, working from home still. But we've been asked to, go to office now. So at past here, I'm here at my office only.
All right, so we are nearing the 2-minute mark, after which we'll end the poll. Okay. So here are the results.
So most of these people know it already.
Yeah, we have a smart group today. I think things are going to be easy for us.
So yes, there are researches which says that sitting is the new smoking, and we have a presentation to show you all. Let me open it. Please bear with me. You must have heard that doctors are quite bad when it comes to maths and technology. So please bear with me. Yeah. Till then, I'll request you all, those who have not replied to the poll yet, can reply. Okay. Yeah, can you all see the PPT?
Yes,
perfect. All right. So they say that sitting is the new smoking, and there are lots and lots of researches, and more than researches, a lot of marketing trend where they say that how sitting and smoking are, same. Now, let us understand why and how did they start this correlation. So when you smoke 2 to 3 cigarettes in a day, what it does to your lungs versus when you sit 2 to 3 hours in one stretch without taking a break on a chair, what it does to your spine. So the idea is your life expectancy reduces the same way the way smoking reduces your life expectancy. And the damage that few cigarettes does to your lungs is the similar kind of damage that continuous sitting does to your back. But again, let us ask ourselves whether sitting can be new smoking or not. Ideally, no. This came up as a study, which was a very weak study. It was done on a very few number of subjects. The population was very small. It was very subjective. Then they did more researches, and they found out that actually sitting is not equivalent to smoking. And the most logical reason is that when it comes to smoking, you can quit it whenever you want. If you're not able to do it, you can take professional help to quit it. But when it comes to sitting, you can't. You just can't, because sitting is a fundamental movement or a position for us. Whatsoever, if you are not able to sit, then this is a serious problem. Because starting from sitting, if we start from getting up from the bed, so first you sit, while lying down to standing, first you sit. Then going your personal routine, going to washroom, then eating your food, sitting in office, all these movements are in sitting. Whereas smoking is something, there are so many people who do not smoke and it does not affect their lives, but sitting is something mandatory. So the newer research says that sitting is not equivalent to smoking. Now with this myth buster, we have to understand that if it is not equivalent to smoking, and still if sitting is causing aches and pain, then what we can do? We can sit better, we can sit tall, and we can examine that what exactly is happening due to which sitting is creating a problem. Why people who sit for longer hours get aches and pain. Now this comes to the next question, that how many of you have experienced aches and pains ever since you have got into sitting job? Can I see the poll questions again? I think a few people have already responded to this question. How do I see it?
Sure, Dr. Sara. I'll just share the results with you.
Yeah.
So we have 93% who have said that I have experienced pain.
That's a lot. So there are 2 people who have not blessed. Touch wood. Okay. So again, see, ever since you have got into sitting job, a lot of people have experienced aches and pain. And for those 2 who have not experienced, I'm very glad that you have not. But if you think of people in your friends and family who have sitting job, they will often complain of aches and pains, maybe in the neck, shoulders, or lower back. The possible reason is we are static in one position, and then it leads to pressure on our spine, on our disc, and eventually it worsens. It's like, if you press, like, if you wear a watch, and if your watch is very tight and you spend the whole day in heat, in sun, and when you come back home and you remove your watch, you can see discoloration. Even if you have removed the watch, you'll see the discoloration. Similarly, when you sit for longer hours, slowly and gradually, it starts affecting your lifestyle, it starts affecting your spine and reduces the life expectancy. Even when you start walking, even when you reduce the number of sitting hours. So even then people do feel that although I have, now I'm not working from home, I'm working from office, even though I have pain, I had to sit a lot in my previous job, but my newer job is better. I'm on go, but still I have the pain. So it becomes a root cause of aches and pain. It's not just a current, it's not just an aggravating factor, but it also becomes the root cause of aches and pains. Okay, I'll see the poll questions again. Results, I'd like to see the results again. Yeah. Now it says, how many of you are working from home and how many of you are working from office? Again, just 1 person is working from home. I hope you are not taking this work from home because you're sick or you have somebody to take care. Almost everyone is working from, sorry, I just said the vice versa. Everyone is working from home. Working from home, not office. Okay, so when you're working from home, what is the possible postures do you take? So I want you all to be still wherever you're sitting, from wherever you are attending this meeting. Please don't move. just observe in which position are you sitting in. Okay. Where do you identify yourself? Are you sitting on a stool, on a chair with both your legs bent? Are you sitting on maybe bed or floor with your legs stretched? Are you sitting on desk? Maybe lying down, maybe on the couch or on the window pane, anywhere, right? So where do you identify yourself? And I want you to remember and be in the position in which you are without correcting, and then see what is happening to your spine. Okay. Now, see and identify, analyze yourself. So it's not a lecture where I have to do all the talking. It's rather a retrospection. It's rather a self-realization in which I want you all to see where do you stand and what is the scope of improvement, if any, right? So for those who are sitting, but sitting either slouched or sitting with hips out and back supported, upper back, maybe a few of you are sitting tall and upright. There could be few people who are sitting but holding a phone, laptop, books, maybe a pillow or anything else in the hand. If not, then laptop in the hand to attend the meeting. Then there could be people who are standing and attending it. Then the ones lying down. So basically this table or this graph says what is the pressure on your back when you are in these positions. So you can see that sitting, the pressure on your disc when you're sitting is somewhere around 140, 105, and 185. And when you slouch and you're holding things in your hand, this is something which happens usually because we are either holding our own laptop if we don't have a proper desk because we are working from home, or we are holding a laptop, cushion, or anything else. The mothers or the parents, they even hold their kids while working from home, right? So this is the maximum pressure that goes on the spine. And this is the very reason that why we start getting aches and pain, because we sit a lot. Now, going back to the previous slide, for people who are working from office, I think there's just one person working from office. So what happens? Even if you have a proper desk, even if you have a laptop at a height where you can see the screen properly and you don't have to slouch, maybe you're not taking use of the chair the way you should. This actually works well also for the people who are working from home and they have a workstation. So some people prefer sitting on the dining table to work. Some people have a study table, and a lot of people have made changes at home in a way so that they sit properly. Correct? So if you have a good sitting workstation, then make sure where do you stand. If you are sitting without back support, with your hips on the edge, your laptop screen little lower, then you're stressing your neck, shoulder, your lower back, your wrist. And I want you to understand that spine, we say back, right? Back is the most important part of our body. Like, how do we say to our friends or family who needs us? How do we say? We say, don't worry, I've got your back, right? Where did this I got your back came from? Because this is how important our back, our neck, our lower back is. If it is all in place, we can actually work on ourselves and achieve all the goals that we want to. Okay, unlike any other joint. So spine plays a very important role. And if anything happens to spine, the problem slowly and gradually radiates to the shoulder, elbow, wrist. Similarly, back pain can slowly and gradually develop into hip pain, thigh pain, knee pain, ankle pain, calf pain. And for your surprise, I want to tell you all that there are so many people who have bad knees. They take treatment, they do not get better. And when we analyze, we see actually the problem was not in the knee at all. The problem was in the back, again, the spine. And what could be the potential reason? I used to sit a lot without taking break. So here, I want you all to analyze how do you sit, okay? So take full support of the backrest, take full support of the armrest, take full support of the seat, lift your laptop or your desktop up and then work. See, you have all the support. Here also, you have all the support. The only thing is we are not taking help of these supports. So please take all the privileges that you have. Heading forward. Okay, now next question. How many of you know that physiotherapy can help in relieving back pain or body pain without injections, medicines, and surgery. So let us see, 24 on 30. A lot of people know it, and 80%, around 80% know it, and 20% doesn't know it. Okay, let's talk about the people who are in the 20% first, since I have to address both of you. So yes, physiotherapy is not just about injury rehabilitation. It's not just about joints. It's about everything. So during COVID, we realized that how physiotherapy can help you to increase your oxygen levels. We also saw that how people who got very weak after the COVID infection, they got recovered, they are all fine, but they often complain that I've started developing forgetfulness, I still feel weak, I still have pain in my joints. So these are the ill effects of the infection that just went. And these can get better with physiotherapy. I know a lot of boosters, a lot of medicines, a lot of supplements we take, and those are important. Those vitamins, those minerals, they are important. But there are people who still feel that something is left. And for that, physiotherapy comes in the picture. Now, there's a difference between fitness level of exercises and therapeutic exercises. So whenever you have any aches and pain, and the doctor tells you that, you have to be physically active to get better, you have to be on your toes, you have to move a little more, maybe you must have put on a lot of weight, and, that's stressing your back, knees, or hip. So now here, the difference between fitness exercises and therapeutic exercises are, it draws a bridge. So here, when you are unwell, and here, when you are all good to go to gym. But when you are unwell and you start gymming, then what happens is recurrences of condition, or the condition gets worse. So in order to bridge this gap, there is physiotherapy. When you do therapeutic exercises to get better, so you start with exercises to reduce your pain, to protect your joints and muscles. Then you reach to a level when you are able to take good intermediate of level of exercises. And when you reach to a level when you can actually do advanced level of exercises with your physiotherapist, that is the time you have to go to the gym. Similarly, there are conditions which are so bad that people have to go for surgeries. And they can be very serious, if I tell you. There are people who complain that they can't control their urine. They have bladder and bowel problems. They can't feel their toes. They can't, there's always a tingling or numbness kind of sensation in the arms, or maybe in the hands, or maybe in the legs, depending upon where the condition is. And that is the time when they are advised surgery. With just 4 to 6 weeks of physiotherapy, these conditions can also be reversed. And that is how surgery and medicine and injections can be, you can get rid of them. And it's not just about delaying a surgery. It's not just about preventing intake of drugs, but it is also about a lot of financial and a lot of emotional burden that comes with medications, injections, and surgeries. Now imagine, just think of somebody who has undergone surgery. They must have spent lakhs and lakhs with the surgery. Then before and after care given by the caregivers, the whole concentration rotates and revolves around the person who is undergoing some kind of surgery. Now imagine that instead of that time and effort and money and emotion, if somebody starts taking physiotherapy at a very early age, so all those burdens are gone. Just 30 to 40 or 45 or even 1 hour of therapies can reverse all these burdens. Okay, now we will see that how physiotherapy can work in other aspect other than surgeries, drugs, and medicine. So I would like to invite Dr. Ashwini, who's a senior and very well experienced doctor. So Dr. Ashwini, please take over.
Well, thank you for the introduction, Dr. Sara. So just, to understand why, we are going through this particular slide, that how can physiotherapy help, to cope up with your work related issues. So, we are working from home or at office, work-related stress is something which you cannot avoid. It's there, however we try, however the management tries, there is some amount of work-related stress. So imagine being constantly in a stressed situation, or on top of that, constantly adopting a very awkward posture, which is going to end up straining your muscles as well. So if you take few breaks and stretch out those muscles or move a little bit, then those muscles get a break, a breather, they get some mobility. So they are pulled out of that stressed position. And if you are in a habit of practicing these breaks, then you are able to prevent strains or any injuries to those tissues because of prolonged loading. Okay, so like to give you an example of prolonged loading, if you look at my finger, okay, if I do this, there is nothing wrong in my finger. Okay, I'm feeling a stretch right now. Okay, that's fine. Okay, imagine your back. Okay, you're sitting like this. Now imagine for 8 hours, I'm going to keep my finger like this. What do you think is going to happen after say 2 or 3 hours? After some time, I am going to feel some pain or discomfort. Okay, and this discomfort is going to last until and unless I release that stress. Now, is there any injury or anything has happened with my finger? No, my finger is perfectly fine. But what has changed then? What has given me this pain? It's the posture, it's the stress of being in an awkward position for a long time. Okay, so that is the stress which is given rise to this discomfort and pain. All right, so going to the next point, how does it improve productivity? If you take care of your posture, with certain things that we'll be telling you about, if you do few movements, again we are going to cover that in the presentation, which will help to stretch out these muscles. When you move about, even those muscles, there is increased blood supply over there, so even that nourishes those areas. So if you're taking care this way, you are avoiding aches and pains. And when you're avoiding aches and pains, you are naturally able to function better, and your productivity is improved. Okay, so it's a no-brainer. How does it reduce work from home fatigue? Now, as Dr. Sara, described in the slides, we are working from home. So, we don't have the ideal ergonomic chair or the table or anything, we are just, lying down on the bed or, on the sofa. We may just, we may have a bean bag in our houses, just chilling, just doing our work, but, not paying attention to our posture. So again, if you end up straining your tissues because of strain and because of any absence of exercises, the weakness and the strain is going to create a vicious cycle where because your muscles are weak, they are not going to be able to take up the load that they are supposed to take for you to manage your daily activity. So that's what's going to build up the fatigue. And if you do physiotherapy or if you do those exercises, it helps to reduce that work fatigue. Office ergonomic corrections, definitely, when you approach, your physiotherapist, and if it is a work related, joint issue or a muscle issue, the first thing that she would do is ask you to, show her your workstation. She would ask you to either, like, if you're doing a tele physiotherapy, she would ask you, okay, show me your workstation, sit and show me how it is. And then she would give you some guidance there and then. If it is a clinic which you would go to, normally the physiotherapist would say, okay, ask somebody to click a picture and, get it to the clinic next time. So I'll guide you how it is. So that's how physiotherapy would work. And now, Dr. Sara, if you can change the slide. And now we have the latest thing of virtual physiotherapy. It was born out of necessity during the pandemic. But, because we wanted to reach our patients, who are far and, who couldn't come to our clinic because of the whole COVID situation. So, initially it was a necessity, but then, we started building up on this technology of, virtual telehealth physiotherapy. And we started thinking that, okay, we need some computer vision technologies to assist us in, making up for some of the issues or maybe drawbacks you might have purely because of the virtual medium. And, there are now, because, we have been in the situation for like 2 years or so, now there have been studies which have successfully proven that virtual physiotherapy is as effective as in-person treatment. Okay, let's go to the next slide. Okay, so enough of the talking. I think, even we should practice what we preach, right? So you have been sitting for quite some time now. So let's take a break and let's do a few movements. These movements, we will be sharing you the handouts for the same, so you can keep it as a reference even after the webinar. So Dr. Sara will be showing you the movements and I would be taking a quick watch on all of y'all. So may I request all of y'all to please switch on your video so I can keep a track on how you're doing those movements. Over to you, Dr. Sara.
Thank you. So to all the participants who are here, please don't feel like it's a school and you have been asked to switch on the cameras. Rather see it positively. Please switch on your videos so that me and Dr. Ashwini can see whether you're doing the exercises properly or not. Because once the meeting is over, you will be able to do these, and when you will do this, you will see a change. Now think of the consequences versus doing it. So doing these ergo breaks or ergonomic exercises on your desk itself can prevent you from aches and pains, conditions which can be so severe that it leads to surgery. But you can reverse all those things with just 5 power exercises. So let's begin with our neck, okay? So if we talk about the neck, so whenever we are working in front of the computer or phone, we have a tendency to lean forward and poke our chin out, right? So when the chin is out, like here, so when your chin is out, then it stresses your neck a lot. The whole weight of your head goes on these muscles and these muscles. As a result, you start getting aches and pain. So this can be quickly reversed by sitting tall and taking the chin in and then relax. Okay, so let's do it. So take the chin in, then relax. You can even use your hand, take the chin in and then relax. Okay, please mind your neck. So you don't have to take your head up. You don't have to take it down. Rather, you have to tuck the chin in as if you are showing your double chin. Take it in and relax. In and relax. So I've kept my hand here as a marker so that I don't poke my chin out, because again, that is something that we anyway do and it's damaging. So this is the marker. I'm going to go behind and stop at my neutral. Behind and neutral. Okay, we'll do 5 more.
Dr. Sara?
Yeah.
If you can just stop sharing the PPT and so that the audience can just see you. We'll just put you on spotlight.
Oh, is it that, as I already told you, like little...
Yeah, okay. I have put you on spotlight.
Yeah, okay.
And everyone, please requesting you all, to switch on your video, please. Yeah, I am looking through everyone now.
Anshik, I would want you also to switch on your camera because you're the moderator.
Sure, why not?
It starts with you, Anshik. Come on.
Sure, why not?
Yeah. So, was it all not visible? The one I told you with head up and down, was it not visible or was it?
Let's do it again. Let's
okay. So whenever you're sitting in front of computer, so we have a tendency to lean forward, right? And it happens quite naturally. Like no matter how many times I tell you to sit tall, you can't. And the only reason is that we are humans, we are not robot. You can't put your body on default, right? But what we can do is we can slowly and gradually get trained and get into the habit to correct our postures. So if this is the typical posture that we get into while we are working, let me move a little far and show you. Yeah. So if you have tendency to sit like this while working, so first of all, sit tall and upright, okay? And take your chin behind. So all you have to do is just take the chin behind. Okay, so if this position stresses the front part of your neck, if this position puts the whole load of your head, so your head can be 5 to 6 kgs. So imagine 5 to 6 kgs of weight on these little muscles. So as a result, these muscles also get weak because they are continuously trying to hold you, right? And the gravity is also pulling you down. So this is one of the major reason that these muscles get weak or tight. A lot of people feel tight and stiffness. So this is the reason. So how you can reverse it? Sit tall, take your chin in and reverse. Okay. Make sure you don't take your chin up. Okay. We don't want you to do this, and don't take your chin down as well. You have to take the chin in. Okay. I'm keeping my hand here as a marker so that I have to stop here. Okay. Chin in and relax. Do it. Let's do it. Keep your hand here on the chest. Rest it on the chest. Very good. I can see a lot of people doing it. Now take the chin in and relax. Take the chin in, relax. Let's do 5, okay? 1, make your double chin. 2, 3, 4, and last 5. Very good. Very good. Okay, the next one is again very easy one. Okay, even if you are in a very important meeting, you can quickly do this 10 chin tucks, right? Because it's not requiring, you don't need any equipment. Number one, you don't need any equipment. That is the biggest burden and biggest reason that people give up on exercise. You don't have to go anywhere, right? And you don't have to buy it every time like medicines. Correct. So once you learn this, you'll be able to reverse a lot of neck related and arm and shoulder related problem. Okay. Number 2 is to squeeze in your shoulder blades. So just squeeze in your shoulder blades and come back. Okay. Squeeze in your shoulder blades and come back. So if you see from the side, I'm just taking my shoulder behind and relax. And while doing this, make sure you don't poke your chin out. So neck in neutral, sitting tall and upright, just shoulder behind, squeeze in as much as you can and relax. Okay, let's do it. All right. Squeeze and relax. Again, squeeze and relax. Very good. I can see a lot of you are doing and a few of you are not. So let's do it. Okay. 5. 1, 2, 3, 4, and one last.
Just a small question, Dr. Sara, in between. What's this exercise actually called? I mean, there's this particular name to this exercise?
Yes. It's called scapular retraction.
Scapular retraction. Okay.
Retraction. Okay. So protraction is when you are sitting and your shoulder becomes like this, rounded. Okay. So this is protraction. A lot of people have this kind of posture. Okay. And just opposite is called retraction. Okay. Okay. So this is what happens when you're continuously working and then behind. Okay. And then behind. This is a very good exercise for the young mothers as well. This is a very good exercise for the teachers as well. So I want you all to learn it because there must be your friends and family who might need it. So shoulder behind and relax. Behind and relax. Very good. Next one. So in the next one, it's called slouch overcorrect. So we are usually already in the slouch position when we sit. Okay. So this is how we usually sit. Slouched, correct? So try to sit tall first. All right. So now I'm sitting tall and this is the slouch position that we get into. So overcorrect it. So arch this part. Okay. Overcorrect, completely arch your back, then relax. Okay. Don't hold your breath. If you'll hold your breath, you'll feel like you're getting cramps, you're getting catches. Okay. So keep on breathing normally. Just concentrate on your spine. Okay. Don't tighten your legs. Don't tighten your arm. Don't tighten your teeth. Okay. Just keep your body relaxed and arch, relax. This one exercise will give you instant relief. If you have to sit for, in a stretch, 45 to 2 hours of meeting. Okay. So 1, again, arch completely. 2, again. 3, don't move your neck. You don't have to move your neck. You don't have to move your neck. Okay. See, I'm not moving my neck. I'm just arching. Yeah. Arch and relax. Arch and relax. Okay. See, we humans are forward oriented. Forward oriented matlab, whenever we are eating, whenever we are talking, whenever we are praying, what do? Forward, right? Whatever work we have to do, even recreation, even our hobbies, it is something that we do in forward orientation, right? The stress is all one-sided and it leads to various problems. So what do? Arch, right? Arch as much as you can, relax. Then again, arch as much as you can and relax. Okay. Now, next one is something that helps a lot for people who have upper back pain, shoulder related aches and pain. Okay. So all you have to do here is take your hip all the way back. So I'm taking my hip all the way back. Okay. And then taking support. And after taking support, keep your hand behind your neck. Okay. So not your head. Okay. Behind your neck. So I'm not keeping my head here. So not here, not here, here. Okay. So just hold your neck. Okay. Keep your hand closer as much as you can. Okay. Not very tight, not very tight. Okay. Then just take your elbows up as much as you can and then come back. Okay. You can also do it by opening your shoulder completely and then go behind like this and then come back. Then again, go behind and come back. Okay, let's do it. So a few of you are moving your neck up. So don't move your neck up. So see my chin. I'm not moving my chin at all. Because it is connected to my body, it's going up. So I'm not doing any additional neck movement. Okay, so yeah. So this is the correct movement. If you are doing this, then this is wrong. Okay, so I don't want you to overextend your neck. One of the easiest trick is to do correct movement is look something in front of you, and while you're looking at it, go behind as much as you can and then come back. Very good. All right. Perfect, perfect. Arch as much as you can and then relax, slowly relax. Yeah, okay. Now next one, the last one. Okay, so I told you there are 5 exercises which can reverse the 5 ill effects of prolonged sitting. Now this is the last one because we are sitting continuously, right? So what happens? Our spine is in the bent position. Okay, this is something very interesting. Okay, this is something that we often notice in our clinic. So if I'm standing like this and if I take this position, what you will call? You'll call it a bent position, right? You'll say that Dr. Sara is bending, correct? Now, if I sit down like this, what is happening? The angle around this area is still like 90 degree, correct? This is again 90 degree. Now, if I bend down like this, if I bend down like this, is it again 90 degree? Now think of people who say that doctor has asked me not to bend. They don't bend at all, but they sit all day. And they feel that even after taking precautions, I'm not getting better. And the doctor feels that my patient has done everything. I think my patient has done like 100%, and now it's time to go for surgery. Now, what was the missing link? Sitting, prolonged sitting. So how we can reverse this ill effect of sitting? Okay. So use the very same chair. You don't need any equipment. Use the chair that you have. If you're at home, use your dining table, use your kitchen slab, use your washroom slab if it has space. Okay. Then keep your hand here. Okay. So I've kept my hand here. Okay. My legs slightly apart. And then I'm leaning behind. And then I'm coming back. I'm leaning behind and then I'm coming back. Okay.
Miss Meenu, your chair is too high. So I would suggest you take another chair to do this exercise.
I'll show you the same exercise with the wall also for those who have very, the headrest of the chair is very high. Okay, so now I'm focusing on my elbow. Okay, I'm focusing on my elbow. I'm not focusing on my neck. So don't allow your neck to like hang completely. Okay, so I have full control on my leg. I'm looking in front and then I'm coming back. 1, 2, 3. Okay. It will be really great if you will get up and do it along with me. There are 2 benefits of doing it. You will know whether it's helping you or not, and you will ask me right away. And if you're facing any challenge, like there's a height problem, or I'm not able to go to a range, or whatever I'm not able to do, you'll be able to ask me right away. Okay? So unless you do it, you will not know it. Let's do it, okay?
Mr. Raj, if you can have your camera a little lower so we can see the chair and you doing the exercise.
Okay, now 1, 2,
yeah,
3, and relax. Okay, now for those who do not have anything to rest, right? So what you can do is keep your hand like this. This whole part will be supported to the wall like this. Okay, I'm standing at a distance and I'm just taking my hip forward. Okay, so I'm taking my hip forward. So this is causing the same kind of motion in my spine. All right. I hope this is easier for you. So again, I can't emphasize enough on this, that these 5 exercises have the potential to withdraw all the emotional, financial, and time, okay, burden that people do get because of aches and pains, because of musculoskeletal and neuro problem they get due to prolonged sitting. So all of these can be reversed with these exercises. All right. Yeah. Over to you, Dr. Ashwini. I'll share my screen again.
Yeah. All right. So you all can now sit back and relax. Okay. We are done with the exercise part.
Keep your questions ready. Towards the end, we will have a question answer Q&A round where we'll be answering all your questions. So if any of you have faced any difficulty, any challenge, then we can discuss it, of course.
Yeah, the next slide, please. Can you spotlight the PPT?
Dr. Ashwini, it's already there. I mean,
okay.
They'll be able to see it. Yeah.
Okay, fine. All right. So now, Dr. Sara wonderfully explained that how you should sit correctly. Okay. Now, if we really go to the nitty-gritties of it, this is how exactly it should be. Okay. Your head, the top of the screen should be at your eye level. And the distance between your head to the screen should be your arm length distance. Again, your back perfectly supported, your elbows 90 degrees, so that you don't strain your wrist. Your hips, knees, and legs, they are all at 90-90. Okay, 90 means an L shape. But it looks very complicated, isn't it? Like, there is just too many things that you're supposed to take care of just to maintain your erect posture. Next slide, please. Okay. Also, another thing that, we have noticed, since we are into online physiotherapy treatment, is when we tell our patients, that, you're supposed to sit straight, or, hey, I'll be checking your sitting posture now, because, since you have work-related issues and you complain of pain during sitting, the immediate reaction is, they get very conscious and they are sitting properly. So what happens is that when you're conscious, at least your body makes an effort to sit correctly. But what happens, when, your focus is lost or you get engrossed in, your work? There are certain deadlines, there are meetings, there are things that need to be get done. What happens during that time? This is a typical posture that would happen, if you are too busy in your work. So now how do we assess your posture? So that's when we use AI, that is artificial intelligence, to assess your posture during these instances. Because it's only then that a physiotherapist would be able to determine that, okay, this is what is happening and these are the changes that they need to do. So next slide, please. So how do we do it? So we at Fit Health use artificial intelligence for assessing posture and the sitting posture that we just described in the slide earlier. For the purpose of this webinar, we have recorded the entire assessment. So Dr. Sara, if you can go ahead and play the video. If you can, yeah, full screen. And can we have the audio, please?
Can't hear.
Oh, not audible.
I think there are some issues with this particular thing. So what we do, we'll share this particular video along with the recording that we'll be sharing forward.
Yeah.
So I'll just talk about, hey, it's me and Dr. Sara, we could do it live. We wanted to relax, but looks like, we will be doing a live one. So, so go ahead and play it and I'll just tell you what it is all about.
Yeah. So the video can be there and Dr. Ashwini can do the voiceover.
Yeah. Okay, let's play it. So this is how we would typically assess the workstation of our patients during our online assessment. So we would start with the AI assessment for posture. As soon as I click on start assessment, you would see certain points getting superimposed on Dr. Sara's body. There you have it. Okay, these are reference points. These will help to determine what is the posture like. Okay, so now we'll see what happens when you adopt a poor posture. This is a relaxed posture, you're chilling at home and, really, doing your work in peace. Now, notice what happens in this. So what we do, we take a screenshot for our explanation and also for our future monitoring of the patient. Then let's do another posture where, you are at the edge of the seat, really engrossed in something which the doctor, which your boss is telling you, maybe nervous a little bit. So that's the typical posture when you're at the edge of the seat. Now there is another posture where, you sit all the way behind, but then you're leaning forward from your back. Again, nervous, anxious, maybe you're not able to see something from the screen. It's the print is too small. The reasons could be any, but that's a forward bent posture. So now I have asked Dr. Sara that, let's show people what is the ideal posture and how should then the reference points look like. So now she has taken a laptop stand and, this is how the ideal posture should be. Again, we would take a screenshot of that and we would keep it for our reference and also to explain to our patients that, look, this is what is happening. So here you have, we use AI technology to assist our physiotherapists in their postural assessment part for their patients to help the patient as well as the physios understand better and treat accordingly.
So this also gets very realistic because most of you are working from home and you will have a different sitting area, you will have a different sitting posture. And these advices which we saw in the previous slides, these ones, yeah. Let me go behind. Okay, now these references which gets too complicated and unrealistic. So based on, if we do AI assessment, when you are sitting using your own table chair, using the same area where you usually sit,
The next
You will
slide.
actually be able to see the assessment of your own, basically.
Yeah. So then, we would capture the screenshots and we would show it to the patient. And this is what the patient will also have, a visual reference of what he is supposed to do and what he's not supposed to do. If you want to take it a step further, we would tell their wives or we would tell their husbands or even a nagging mother-in-law that, hey, this is your job. This is your opportunity to nag them. I want them in this correct posture. Every time you see in the other 3 postures, this is your golden pass. All right. So yeah, jokes apart, but this is the way, we would try to encourage and reinforce the ideal sitting postures, for our patients. So next slide, please. So we at Fit Health are going to offer free consultations to all PAS Care members, and you can extend this offer to your friends and families. Just make sure when they are coming for the consultation, they do tell us that, hey, we are referred from PAS Care webinar, so that, we can give them the free consultation benefit. All right, so now it's time for questions. Let's see the chat box and let's pick up a few questions.
Yeah, just before that, I would request, Dr. Sara to, if she can, stop sharing the screen again so that we can actually have all the participants. Perfect.
Yes.
So I think we had one question already, which was answered by you in the chat box itself. Then we have one more question, and I'll just take it up with you. Is there any preventive diagnostic check for the current health of spine?
So when we are talking about preventive diagnostic check, it's not a test per se, like, if you were to label acha MRI kar lo, acha, do an X-ray or something. But when we are checking for the muscle health, we want to check a couple of things. One is your posture. One is your movements across all the joints. The other one is what is the flexibility of your muscles and what is the strength of your muscles. So all these 4 things would help us to assess where the problem lies. Also, because it's preventive, if some of you all are interested into sports or some recreational activities, like, we've had like people who say, hey, I want to run the next Mumbai Marathon. Or somebody says, I'm very conscious about my health. I want to take care of my health. I want to go to the gym. Or say I want to do, I want to play some kind of sports. So we would then assess their body's capacity to do those activities. It could be like standing in one leg, it could be jumping, kicking, just those quick agile activities to just determine if you are ready to, pursue these activities. And, if there are any issues, maybe there are some aches and pains or there are some weaknesses or tightnesses, then, we could teach you certain exercises or certain things for that so that you can work on those and then resume those activities. So we have a lot of patients, they had these sciatica complaints. Once they get resolved and once they are nearing the end of our treatment, they will say, hey, I want to join some Zumba class. I want to do some, fitter or something like that. So then we would collaborate with their trainers as well, because there are certain things they can do, certain things they cannot. So you cannot just randomly enroll yourself in any activities, because when they are doing a group class, they have a certain standard exercises based on the assumption that the participant has no pain and, has a basic level of fitness. But if you are recovering or if you have recovered from an injury, I would suggest that, get yourself checked and don't push yourself, understand the limitations of your body and accordingly work on, improving your fitness.
Got it. So next
I would
question.
also,
I
would like to add one more thing. When it comes, because your question was very specific to the spine. So the spinal muscles, they have 4 functions: flexibility, strength, endurance, and stability. So on all all four this grounds, there are various tests which are done, and these tests are not blood tests. These tests are not scan, but they are done through movements. So when you connect on video call, we, as Dr. Ashwini said, standing on one leg, it talks about the stability. And if you're able to maintain the position for a longer period of time, let's say for a minute or two, then it talks about your stability along with your stamina also. Then there are few tests through which we check the other things also, like strength and flexibility. So four different function of muscle, and based on four different functional tests. Yeah.
Got it. So next question is by Tirtha. So he is asking that during the last exercise, I felt pain in my left neck and head like something was pulling. How can I relieve that tightness?
So Tirtha, the exercise of bending backward, was that the one? So I had requested you to adjust your camera so I could see you performing the exercise, but that was not possible during the session. So if you can just show us right now, we would just quickly correct you.
Ma'am, can you see this? At this level, my chair backrest is there. At this level, just at this level. I cannot hear you, ma'am.
Dr. Ashwini, I think you are on mute actually.
Okay. So Mr. Tirtha, we need to see your spine. We need to see your hips. We need to see at what level the chair is with reference to your height. So if you can just lower the camera, if you're using a laptop, just lower the screen. Okay. Now, which chair were you using? So can you lower it a little bit more, because we are still not able to see the chair. Yeah. Okay. All right. So Mr. Tirtha, the chair is too low for you. I think it's somewhere around your buttock area.
Yeah.
That height is too low for you. It should be, where you're putting your belt.
Okay.
It should be at least up to that height.
All right.
Okay, so maybe that was the reason why you felt the strain. Okay. All right. So I hope that answers your question.
Yeah.
Regarding the handouts and the recording, they will be sent to you via email, as Anshik has replied. Then there is another question. Does traditional cross-leg sitting benefit the spine? So, if so, can it be done in intervals? And would it be recommended to a person who has recovered from cervical slip disc, as it is advised? Okay. So what happens with cross-leg sitting is, nowadays, we are not sitting in a cross-legged position for a long time. So what happens is you get tight around your buttocks, your hip areas, your inner thigh, even, the back of the thigh, hamstring and all. These get tight. And when they are tight, suddenly when you try to adopt a cross-leg sitting posture, your back won't be allowed to sit tall. It will be like it's pulling you from one end. Okay, so if you can see my hand, so if this is the hip area, my hip muscles are too tight, it'll pull the spine forward. And what happens as a result? My spine is curling. It's not straight. It cannot be straight because there is too much of tightness around the hip area. And it is this curling of the spine which is what strains your neck, your back. Because what we recommend to patients when they have any issues with the spine is you try to maintain a correct posture of your spine, which is straight. Now, it's not the extreme also. Okay, if you can bend so much, maintain this, no. Or if you can bend so much, maintain this, no. So if this is your range, you have to settle in the middle. It's what we called as a neutral zone of the spine. That is where the muscles, the tissues are functioning optimally. Okay. Now, going back to cross-leg sitting. So now if it is tight and it's pulling me down, this strain is what is not advisable to your slip disc patient, or be it cervical or be it lumbar. So I hope that answers your question. So if you have individuals who want to sit cross-legged, please work on stretching your buttock muscles, your hip muscles, hamstrings, but please do it under guidance, because what happens is typically if you want to stretch your hamstring, what you will do is you will bend forward, okay, which may or may not be advisable if you have a slip disc issue. Okay, so let's go to the next question.
Also, Ankita, I would like to add that sitting cross-leg is like ice cream. And when you have cold and cough, no ice cream, right? So you're not allowed to have ice creams when you have cold and cough. And once you recover completely, maybe after a week or two, then you can have ice creams, right? Ice cream or anything cold. So whenever you have aches and pain, whenever you are diagnosed with a condition, you should not sit in cross-leg position because it has potential to increase the problem. However, if you go through a rehab, if you go through the bridge that I told you, so your cross-leg sitting is towards fitness. And when you have a diagnosed problem, you need to bridge that gap with rehabilitation and therapeutic exercises, as Dr. Ashwini said.
Okay. So, Miss Meenu, for your cervical issue, I would advise you to please, avail the free consultation that we are offering to all PASCare members, because we really need to go through your reports and really understand what exactly is your issue. Okay, I hope that answers your question. It is said when you are suffering some kind of pain in a particular body part, you should not exercise, otherwise it aggravates the pain. Is it true? Okay. So it depends on the type of condition you have. 85% of back pains come under the category of mechanical back pain. That means there is a mechanical problem related to movement or postures. So at the time of consult, when your physiotherapist assesses you and asks you to do certain things, she may ask you to do a certain movement a couple of times, and then she will check, okay, let's see how your painful movements were. Let's see how your walking was. Has it improved by this particular movement? And if there is any change, then your back pain would be then categorized as mechanical low back pain, because it is changing. I wouldn't say responding, I would say it is changing to mechanical movements. So to answer to your question, exercise, whether it aggravates the pain or not, has to be first determined, okay, and by a medical professional. And there are categories also. So I wouldn't suggest you to, try it out on your own. Please consult a medical professional for this, because, you have both the extremes. So we need to figure out what is your case and accordingly guide. All right. My mom is diagnosed with sciatica pain. So can free consult? Yes, sure, Miss Nimisha. Please ask her to avail the service. Is there a way I can correct forward head posture using exercise? Yes, Binal, you can. Please approach us. What things should we take into account while buying a work chair if I am at my desk more than 9 to 10 hours? Dr. Sara, if you want to take that question.
Yeah. So there are a few things which are like very important when you consider buying a chair. The first thing is, because you have to be on that chair for like good 8 to 10 hours or 9 to 10 hours, as you said. If it has a recliner and it has all the casters that you can roll, twist and turn, then it is something which not good for you. The only reason is that it reclines you and takes you in a bad posture. Rather, you can get up and take a posture break. When you're buying a chair, it must have an armrest so that you can keep your hand by the side. So you should keep your hand by the side, okay? So armrest is the first thing which should have, right? The height of the chair, it should be in a way that when you're resting, when you take your hips all the way back, your legs should not hang that time. Your foot should be completely planted on the floor. So that is how you'll understand the height. There are lots of chair which is adjustable. So make sure it can be adjustable to a range when you take your hips all the way back, your foot should be planted on the floor. Then the next is armrest, as I told you. Then the third one is your backrest. So a very short backrest, like mine. This is not an ergonomic one, right? Because I don't sit as much as you have mentioned, 9 to 10 hours. So this is very short. So it should be high, at least up to shoulder level. So the backrest should be up to shoulder level. Either it should not have the facility to recline, and if it allows you to recline, then it should have a lock for sure, that when you're working, you can lock it in a particular angle, like somewhere around 90 to 110, not more than that. 90 to 110 recline should be there. Then the chair should have a S shape. Okay. So this S shape will give you a bump on the small of your back. So if I'm sitting here like this, okay, and my chair is completely flat, okay, so I'll show you with the help of a book. Yeah. So suppose the backrest of the chair is completely flat, then this small of the back, this one, how do I show you? Small of the back, this area, this arch that we have, this arch, this will not get support. Okay, we will only the upper and the lower part will get support. So we need a chair which has a small arch, a cushion kind of structure which supports this part, and it should push you to be in this position. So if you remember, we did exercise also to correct, right? So the chair should have a S shape, and the concave should push you in this position. Okay, this is the first and the most important thing other than the height of the chair. All right, I hope I'm clear. Do you want to add anything, Dr. Ashwini?
Also, a lot of times, when we are discussing ergonomics with our patients, they tell us, I have bought the best of the chair and everything, but you need to check around the seat area. How is the curve? Sometimes, they have a very peculiar curve, or they have like these extreme, I would say reverse K kind of a thing, those back supports are not comfortable for you. Okay, because what happens is you would tend to arch a lot, how Dr. Sara explained during that arch exercise is your buttocks would go behind, but just because how the backrest is made, like, a reverse K, you would arch at a higher area on your low back, and that area would get strained unnecessarily. So don't have these extreme arches, have something which will be more or less straight. Okay, even at the buttock area. So it should be like an L shape rather than being more curved or, some any weird shapes that you might see. Okay, let's check another. I am suffering from severe shoulder pain. Anita R, I would request you to please get in touch with us and avail the free consultation with us. We would want to see in detail what's going on. Okay, if you have any reports and all, you would want to discuss it in detail.
I think, Dr. Ashwini, this should be, our last question.
Yeah.
Samriti Gupta, we are already, over time. So this would be our, last question.
Okay. So what kind of pillow one should use to avoid neck pain and sleep posture? I would take it together. Okay. So with reference to pillow while sleeping, we need to understand how do you sleep, okay? Some people, they sleep on their back. Those are the easiest one to correct, okay? Some of them are sleeping on their sides. The others, they sleep on their stomach. So based on that, we give them certain recommendations. So if you're sleeping straight, your pillow should, okay. So if whatever is the curve of your neck, okay, the pillow should fill this gap, and the lower border of your pillow should be just around your shoulders border. Okay, you should not keep your pillow down, because what will happen is then the pillow will push your shoulders forward, and that's what we don't want. Okay, so I have a big, okay, so imagine this is a book. Okay, imagine this is as a pillow, so it should be like this and not down. Fine. Sometimes what happens is we have individuals who have the arch a little bit more. So for them, what we tell them, so even if you have taken a flat pillow, you still feel that the arch portion is still not getting supported. What do you do there? In that case, you would take a napkin, okay, you would roll it up and keep it in this gap. Oh, I'm sorry. This gap. So this part is the one that needs support, not your head. If you keep it up, your head will go forward like this, not your shoulders, because if you keep it near your shoulders will go forward like this. And this is exactly what we don't want to. Okay, so that's for those who sleep on their back. Now for those who sleep on their side, okay, so imagine this is my side. Okay, a thin pillow, what is going to happen? Okay, if my shoulder is, so my shoulder is here, so my pillow would be somewhere here, right? This gap ideally should be filled by the pillow. Otherwise, I will sleep like this all the time. Okay, now imagine sleeping 8 hours in this position. You should be sleeping like this, but you end up sleeping like this all the time. You're going to strain your neck a lot. Okay, so when you're sleeping on your side, the thickness of the pillow should be to accommodate this distance between your shoulder, am I clear? Between the tip of your shoulder to the base of your neck. Okay, that is the distance that it should accommodate. Another common problem is, where do you keep your hands? Do you keep them like this, or what do you do? If you keep them like this, the weight of your head is going to press on the tissues and the nerves here. So you will end up getting numbness, tingling in your hands. So that's also not right. So then what do you do? So now I'm just showing. So your hand should be this way there. Okay. And okay, I have to use a book. Please excuse me. Okay. So your hand should be like this. It should not be up or under this pillow, but it should be like this, away outside the pillow and in this position. Got it? Was it clear? This position. Okay. Now for those who sleep prone, those are the ones that will typically end up straining their neck. If possible, please try to avoid sleeping in that posture. Or if you do end up sleeping, then we don't want the extreme, cranking of the neck in that posture. Okay, because if you would sleep on your stomach, you would sleep something like this, and then you would end up straining your neck like that. So in that case, and also what happens is your shoulders would droop down all the time, especially for ladies, who have heavy chest, because there is a gap, the shoulder would automatically fall down, and then you would have again some shoulder issues. So if they are comfortable, you could keep a pillow like this. Okay, only for women I'm talking about, because to accommodate for the chest area, you can then keep a pillow here to ensure that your shoulders don't droop down and you don't go into this posture. Okay, now all said and done, we are not robots. So even if you sleep in a one posture, there are chances that you can change. So what we can do best is, whenever you're alert, whenever you get up at night, to use the washroom or something like that, it's only during those alert times that you adopt these correct postures, so that you are ensuring that the stresses to your spine are minimal. Okay. I hope this was an interesting lecture for all of y'all. And I hope we have covered all the questions. Anshik, are there any more questions?
No, I think the last one was answered by Dr. Sara on in the chat box itself.
Okay.
So, yeah, I mean, thanks a lot, Dr. Ashwini and Dr. Sara, for your time and helping our the past care community for hosting this wonderful session and taking your time from your busy schedule. And thanks a lot, everyone for joining in. We hope to see you once again. We'll be keep that we keep on hosting these wellness sessions for our community, and hope to see you again. Thanks a lot, Dr. Ashwini. Thanks a lot, Dr. Sara, for being a very good orator here, helping us out. And guys, for you, we'll be sending out one feedback mail to you. Do share your feedback, and if possible, do make a post on LinkedIn or on Twitter, appreciating past care as well as fit health. So we look forward to host you once again in our upcoming wellness session.
Thank you so much, Tirtha, and thank you so much, everyone, for those kind words. And I hope we have some of you who have serious pains, avail the opportunity of free consult and see us, one-on-one
Sure.
for consultation.
Apart from
Thank
that, we'll be sharing the recording, those handouts, I guess, for the ergo break exercise, as well as the past care, the free consultation thing.
All right.
All right.
Thanks a
Thank you,
lot.
everyone.
Okay.
Thanks a
Thank
lot.
you,
Have a great
everyone.
weekend. Have a great
Bye.
weekend.
Okay. Bye-bye.